In this recording, we're going to discuss cardiac conditions. The first one we'll chat about is congestive or chronic heart failure, CHF. Heart failure is defined as any condition that reduces the heart's ability to function effectively as a pump. Remember, ultimately, the heart, its job is to pump blood. So anything that causes the heart to be less effective at pumping blood collectively is known as heart failure. This could be caused by several different conditions. The first one being coronary atherosclerosis, which is kind of hard to say. Clogged coronary vessels with fatty buildup can reduce how much blood you are pumping through those coronary vessels themselves. High blood pressure. If you increase your blood pressure, you are increasing your afterload. Your myocardium, your heart muscle, must exert more force to expel the blood. This leads to hypertrophy of your myocardium, which basically means your myocardium gets bigger. And here again, we have the not every good thing is a good thing. You would think, oh, your heart muscle's gotten bigger and stronger, it should work more effectively. And it just doesn't work that way. Eventually your heart muscle starts to wear out. Multiple myocardial infarctions, MIs, heart attacks. Anytime you suffer from a heart attack, you are killing some of your heart cells. And we have learned in the past that cardiac muscle cells do not regenerate. You repair damaged heart tissue through fibrosis. Instead, you create scar tissue. Scar tissue isn't very good at muscle contraction, and so you lose function there. And then we have dilated cardiomyopathy, DCM. Your ventricles become overly stretched, and this is weird, but they become flabby. We're not 100% sure what causes this exactly, but if you overstretch your ventricles, if they become flabby, kind of think of it like an overstretched rubber band. It's not quite as effective as it once was. Generally, these types of heart failures will result in decreased stroke volume, which we've learned that reducing your stroke volume will also reduce your cardiac output. So you're pumping out less blood to your heart per minute. Now, depending on which side of your heart is affected will depend on what kind of symptoms you suffer from. Left side heart failure. Remember, what does the left side of your...
Sorry, I'm not sure. By the way, I can learn your voice to improve your Alexa experience.
Y'all hear Alexa stalking me?
Got it?
Shh, Alexa, shh. Left-sided heart failure, your blood will back up into your pulmonary circuit, because where is the blood coming from? If it's trying to get to the left side of your heart, it's coming from the lungs. We call this pulmonary congestion. Okay. This pulmonary congestion will increase the pressure in those vessels themselves, the pulmonary vessels. Increasing the pressure in these vessels will drive the fluid from your pulmonary capillaries. It will force the fluid into the lungs themselves. We call this pulmonary edema. Your lungs do not function quite as well if they are full of fluid, and this will lead to suffocation, and it could ultimately lead to death. On the other hand, right-sided heart failure, the right side of your heart is receiving blood from your periphery, your systemic system, the body itself. And so if blood backs up now, we call it peripheral congestion. So instead of the fluid filling up in the lungs, now it backs up into your venous network, so the veins throughout your body. Your organs, your tissues, can start suffering from edema. We call it peripheral edema. It's really noticeable, usually in your extremities, especially your arms and legs. So how are we going to treat this? Usually treatments are aimed at increasing your cardiac output, so we're trying to get more blood to be pumped out of your heart per minute. And we can do this in a couple of ways. Decreasing abnormally high preload. So what was preload? It was how much blood we were putting into the heart and stretching it out. If we decrease this volume, then your heart doesn't have to work quite as hard. Decreasing your preload, we're going to do this by giving you diuretics. That promotes fluid loss. It will decrease the blood volume. Okay, it won't make your heart work quite as hard to pump all that blood around. We can also increase your heart's contractility. Okay, so we can provide you with therapies that make your heart pump harder and more effectively. And we can also decrease your afterload. Okay, so remember your afterload is basically your blood pressure in your aorta and your pulmonary trunk. So if we decrease your afterload, your heart doesn't have to work as hard to overcome that pressure. And so blood pressure drugs will do this. Digitalis will do this as well. In some cases, a patient might be the recipient of a heart transplant, or perhaps need a pacemaker that will increase the stimulation of the cardiac muscle as well. And just as a reminder, left-sided heart failure, okay, you are going to be backing everything up in your lungs, okay, fluid in your lungs. Right-sided heart failure, instead, you're going to be backing things up into your organs and your extremities. Okay. Now, heart attacks themselves, we've mentioned these a couple of times, myocardial infarctions. Anytime you suffer from a quote-unquote heart attack, you are basically interrupting blood supply to certain parts of your heart. And if your heart tissue is not getting blood, that cardiac tissue very well could die. We have mentioned that cardiac cells are not able to do regeneration. They are amitotic. So instead of growing new cardiac tissue, you would replace that instead with collagen fibers or scar tissue. Scar tissue is not really built for muscle contraction. Sometimes the causes include blocked coronary arteries, sometimes called a thrombus, or an embolus. Okay, so you can block a different artery. And then your vessels could be blocked due to atherosclerosis, so those fatty plaques that narrow the vessels themselves. Sometimes those fatty plaques will just completely block the vessel itself. To diagnose a heart attack, we are going to hook you up to an EKG, and we can also study some of your serum enzymes. So for example, troponin and creatine kinase. Troponin can help you differentiate between just chest pains and a heart attack itself, because damaged heart muscles would cause elevated troponin levels, but angina, just chest pains, would not. But creatine kinase, it can indicate muscle damage, but it's not specific to just heart muscle damage. So it could tell you that your heart muscle has been damaged, but I don't know, perhaps you've gotten into a car accident and your leg got mangled, and so the skeletal muscles in your legs are actually the ones that are pumping out the creatine kinase. So the CK is kind of a starter point, and then we can measure the troponin, we can look at the EKGs. We need kind of further proof to figure out, is this really a heart attack or not. Treatments for heart attacks. So post-heart attack, we are going to probably provide you with medications that lower your blood pressure. For example, beta blockers, which inhibit your sympathetic nervous system. This prevents an increase in blood pressure. Even if you, so like if you work out, if you exercise, if you take these beta blockers, your blood pressure would not be elevated, things like that. So that's kind of interesting. And then ACE inhibitors. So hopefully you have mastered aldosterone by now. If you remember the RAS system, the renin, angiotensin, aldosterone system, aldosterone ultimately increases your blood volume, which increases your blood pressure. And all of that comes from the conversion of angiotensin 1 to angiotensin 2, which is what ACE does, is angiotensin converting enzyme. If we block the conversion of angiotensin 1 to 2, ultimately you will not produce as much aldosterone. If you don't produce as much aldosterone, this will lower your blood volume, which will lower your blood pressure. Okay. Normal symptoms of a heart attack include pain in your chest, jaw, arm, shoulder, all those places. Sometimes some people feel like they've got really bad indigestion, even like a nausea and a vomiting, clammy, moist skin, sweating. Women tend to also have like low back pain, things like that, which most older women already have low back pain, so that's not necessarily a useful symptom for them. Angina pectoris specifically is just chest pain. It's these temporary ischemic events, so just very temporarily cutting off oxygen supply to the heart muscles. Not long enough for the myocytes to die, but it is kind of a warning sign. You'll also get the chest pains, the difficulty breathing, shortness of breath, things like that. This is caused by the coronary vessels starting to have the atherosclerotic plaques building up. Nicotine can cause coronary vessel constriction. Really strenuous exercises after you've eaten, or even high blood pressure as well. So make sure you know the signs, the symptoms, if not just for your exam, but just for your personal well-being as well.